Revision otoplasty because of asymmetrical ears after initial otoplasty. Hello, 4 months ago I had otoplasty and the surgery wasn't really successful. There's around 8 mm difference between my right and left ears. My surgeon told me that he could fix that with earfold, and I was wondering if that's a common practice. I couldn't find any information about earfold after otoplasty.
Thank you for your question. You've submitted your question with several photos, and you state that you've had otoplasty several months prior and that you have an 8 mm difference between the relative prominence of the ears, and with the photos it appears to be the upper part of your ear, and that your surgeon recommended revision surgery, and it seems like you're wanting to get an opinion on whether or not this is something that can happen or is done relatively frequently. Well, certainly I can give you some guidance on how I counsel my patients about otoplasty and about the need for revision. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan, Long Island for over 20 years, and otoplasty is amongst the many different procedures we offer in our practice, and it is something that does require a very systematic approach and certainly a discussion about revision. And so we'll explain a little bit further. So when you look at an ear and you're trying to evaluate the type of otoplasty that's appropriate, you look at the ear basically from the perspective of dividing in the upper third, the middle third, and the lower third, or basically the development of what's called the antihelical fold, the development of the conchal bowl, or the central part of the ear, which is where the ear canal is located, and the earlobe. And so in your case, I think that the challenge occurs in the upper third. The upper third, which is where the antihelical fold, the fold that is right below the outer rim of the ear, when it's prominent, it's not as well developed. So when a surgical procedure is performed, I routinely perform what's referred to as Mustarde sutures, and these are sutures that after the cartilage is relaxed in different ways. Some people use a burr, or some people score, but essentially to relax the cartilage so it can be more bendable, you place these stitches, and these stitches bend the cartilage so that it creates this fold. Now, one of the challenges with this, of course, is besides achieving symmetry bilaterally, but it's also the challenge of the way the tissue heals, as well as the memory of cartilage. Cartilage is very stiff, and it has the potential to snap back. Sometimes it's just a matter of the stitches. Stitches may not have held as well, or the stitches could have broken. But essentially, it is an outcome that I do explain to my patients you have to be prepared for. Sometimes people get very obsessive about the symmetry, but I think certainly there's an opportunity here with the significant difference between the two ears to revisit that particular area and to do an enhancement. You know, I think that one of the just realities of cosmetic surgery is enhancements are part of the nature of what we do. And a very famous doctor said, a very famous surgeon said, a surgeon who claims never to do enhancements either never does surgery or is just lying. And I think the same applies to complications. You know, this is part of the reality of what we do. So I think that if you clearly made a decision to choose this particular doctor, and I think that if the doctor is ready and willing to do an enhancement and certainly will give you the appropriate guidance, then I think it makes sense for you to move forward and get this concern taken care of. Again, understand that this is an area where you're depending on a lot of behaviors or tissue mechanisms to actually work as predictably as it appears during surgery. I always tell when I did a lot of teaching of residents and fellows, that if it doesn't look good in the operating room, it's not going to look good outside of the operating room. So I think it's very important that you also understand that your surgeon finished the surgery most likely feeling good about the way it looks, and then when you get a result where there is this asymmetry, appropriate enhancement makes sense. So I hope that was helpful. I wish you the best of luck, and thank you for your question.